Welcome to the COVID-19 Executive Series from USI. Today we're going to be talking about reopening guidelines for the film and TV production industry. My name is Matt Watkins. I represent the entertainment practice for USI. Today's agenda, as you can see here, we're going to be talking about developing a strategy for going back to work in the COVID-19 environment, what goes along with that, the actions you take during pre-production to prepare for a safe filming environment, both in preparing your physical locations, also how to plan for preparing your cast and crew. Then we're going to talk about what a safe production could look like, and then we're going to bring it all together at the end. So first and foremost, you want to develop a detailed operational plan for establishing a safe workplace. Good recommendations to use CDC and OSHA requirements as a baseline, kind of a starting point for creating that plan. We want to make sure that we have a written plan because it's going to be necessary to respond to regulatory authorities. And if you're going to have a written plan to share with regulatory authorities, let's be sure that we're actually following the plan. Let's make it actionable, things that we can do. Let's not just make a written plan that we have on the shelf. Let's actually follow the plan that we create in writing. Also, let's make sure that we're communicating our plan to all our employees, any cast, crew, as well as any third-party vendors, caterers, extras that might be on set as well. And here at USI, we're happy to help in developing that plan based on the specific needs of your production, as well as providing virtual training in areas where it's needed. So as you can see here, from securing your location when planning in pre-production, there's really 8 main considerations. I'm not going to go into all of these. I will say on number 5, inspecting the mechanical systems. This is very important for the studios to consider. Performing inspection of your HVAC systems, boilers, etc. We want to make sure that ventilation systems are adequate for increased ventilation as productions come back to work, as well as changing out air filters, using and changing those air filters while using appropriate PPE, including respirators and gloves. Then looking at number 8 there with flushing the drinking water. I know many facilities and studios have really shut down their running water while the studio has been closed. In addition to getting the water back up and running, let's make sure that we're using the EPA's flushing best practice guidelines to make sure that it's clean water that we're using once we get back to work. Again, from the location subject, when we're doing location scouting, let's make sure that we do that remotely. If we can't scout remotely, let's make sure that conversations are being held outside when scouting. Treat all your shooting locations that you're looking at as if they are infected, so use PPE when scouting and following pre-cleaning guidelines before you actually get to shooting at these locations. In addition, let's make sure once we're on set and on filming locations that we're preparing and stocking hygiene stations. So I'm talking about hand washing soap, sanitizers, paper towels, etc. And if you have no-touch, or if you have disposable PPE, let's make sure we have no-touch biohazard waste receptacles with closed bin for those discardable items, and just make sure they have sufficient stock of all the supplies as well. And then you want to make sure that you're doing things like placing markings on the floor 6 feet apart at high traffic areas, so cafeterias if they're there, wardrobe, production office, makeup, etc., just to make sure people are staying 6 feet apart. Also, as you've probably seen in grocery stores and restaurants, putting signage on the floor to specify one-way movement in different areas are some good to follow techniques. So that's location. When also planning in pre-production, for planning or for preparing your cast and crew for getting back to work, a couple things to keep in mind. Let's try to keep castings remotely if possible. So we want to get rid of open casting calls, and assign windows for people to arrive, specific times for people to come and arrive. Let's encourage our actors to wait in their cars until the scheduled time. Also, in the case of printed scripts, those should be personalized, and each recipient should only handle his or her own script. Also, when planning, let's think about things like giving consideration to actors arriving on set in their own wardrobe. When that's possible. I know sometimes that's not possible. So going back to that ventilation issue before with the HVAC system, let's make sure that ventilation is increased in those areas like dressing rooms and makeup, etc., places where maybe multiple people congregating are hard to avoid. Make sure the ventilation is increased there. In addition, from a cast and crew safety standpoint, temperature checks. You're going to have to decide between on-site testing options or self-certification. There's kind of pros and cons of both, which we're going to get into now. So when looking at potential on-site testing, COVID-19 testing currently cannot be administered by on-site clinical staff or contracted nurses. It's got to be off-site. But most on-site clinics and nurses may be able to provide a COVID-19 test in the future, but the tests are going to need to be CLIA waived, just like you would for an on-site cholesterol screening or blood pressure test. Antibody testing is another tool with a vaccine probably at least a year out at this point, if not more. This is a way to offer employees and cast a way to know if they've been exposed and potentially are protected to the virus. There's several different tests that are available, but as of now, none are FDA approved. Something to keep in mind. A very common method for screening employees as well as via temperature checks. Many organizations are screening personnel in that way to assess their sickness. So when we're talking about testing format for thermal testing, what we really are recommending are no touch options. So different, either infrared cameras is one option where you have employees, in this case cast and crew, that are walking in single file lines through certain parts of the set. These cameras are capturing employee body temperatures, and then you can see who has an elevated body temperature and then go from there. Although taking cast and crew temperatures can be done by an employee, something else to consider is providing PPE and training, so training for the trainers in this environment. Medical staff that's monitoring this procedure has to keep the health records that you take from here separate from your employment records. A third party can also be used. We're seeing a lot of clients do this to administer the temperature testing, and this can limit your exposure and your employees' exposure and limit confidentiality issues as well. We have a couple of vendor recommendations that we're happy to make in this space. Other thing to think about if you're going to do on-site testing is this is another area where a lot of people can tend to congregate. So in these studios that have larger parking lots, could be a way to keep people outside the physical location and spaced out. You could keep people in their cars until they're tested, things of that nature. You could use staggered start times, different ways to be creative and avoid a large volume of employees standing together waiting to be tested. So like we alluded to, in addition to the on-site options, there are self-certification options where you have your employees, this is a big issue in the restaurant industry, certifying daily that they're symptom-free, they're taking their temperature daily at home. And then there's some app-based systems where you can easily track the self-certification of employees, certifying that they are not showing symptoms, don't have high elevated body temperature, excuse me. And this is an easy way to ensure confidentiality of cast and crew data as well. So once you're actually on site and in production, a couple things to keep in mind. Obviously using PPE, as I said a couple times already, goggles, face shields, masks that cover the nose and mouth. If you're going to have disposable materials, make sure they're disposed of in closed bin receptacles. Also, you need to make a decision here on whether you're going to provide the PPE yourself or ask people to provide their own. Like we've said before, in the common meeting areas, the common places where people come together, let's make sure we have 6-foot markings on the door, on the wall, or on the floor to keep people from getting too close. Also, let's avoid in-person meetings where possible. Use phone and video if it's available, and make sure those hygiene supplies that we're supplying are stocked on a regular basis and we're not running out. In addition, we want to monitor high-touch areas like elevator buttons, door handles, copy machines, bathroom doors, tables and chairs. Make sure we're wiping them down on a regular basis. Also, where possible, use electronic or digital call sheets, production reports, contracts. We want to eliminate the distribution of paper between shared hands as much as we can. Also, we know that there's a kind of a tradition of allowing guests on set on a regular basis. We really need to investigate that policy. Our recommendation is to keep outside personnel outside. Only essential personnel should be on set or in the production office. I mean, simply put, if somebody doesn't need to be there, then they shouldn't be there. If people who are handling equipment on a regular basis, so camera operators, grip, hair, makeup, etc. Really, they should only be handling their own non-shared equipment. That means in the planning process, you might want to account for extra gear that may be required so you can keep people from sharing equipment. Last area to really cover, we get a lot of questions around the insurance implications about going back to work right now. Kind of the high touch point areas are workers' compensation. There's some challenges here from a coverage standpoint. Occupational disease already brings about a lot of challenges with triggering coverage. Carriers are going to review and they're really going to deem a claim to be compensable or not per the state work comp statutes, a state by state issue. In addition to that, many production companies buy work comp through a PEO. Employers' liability limits here are really a challenge because you're subjected to the limits that the PEO has. It's a case-by-case scenario. We're happy to have a one-on-one conversation to help determine what limits are available. From a general liability perspective, the top of mind thing to keep in mind is there a communicable disease exclusion on the current policy? If so, this could present some challenges for third-party risk related to COVID-19, but again, it's a carrier by carrier and really policy by policy issue. With your directors and officers coverage, there could be a reputational harm risk that results from opening studios and getting back to production work. We've already seen some scenarios where employees are filing suit against employers for going back to work too early or for not adequately preparing them for working in the COVID-19 environment. We want to make sure that your coverage in this area is buttoned up so that the personal assets of the company directors and officers are protected because the corporate veil can be pierced. Last insurance note is around CAS coverage. Many carriers have simply just stopped providing CAS coverage, or many others are also providing CAS coverage, but at a much higher premium cost or higher deductible levels than they were before. Also, many are writing in specific exclusions around communicable diseases, viral infections, or even specifically COVID-19. So ultimately, at the end of the day, like the other coverages, it's up to the carrier to ultimately determine coverage, but this is another area where there are some challenges. So with everything we've talked about today, be it preparing for going back to production, what you actually do once you're there, your insurance coverages, this is an ever evolving landscape that's going to need everybody involved to be flexible and open-minded. Just because we have a plan today doesn't mean that it can't change tomorrow. We need to be on top of constant developments. There's guidance out there from CDC and OSHA that's changing all the time as the situation evolves. In addition, the unions and guilds in our industry are releasing guidelines and worksite rules for safe production. We want to make sure that we're following those and keep track of developments there as well. Here at USI, we've got hundreds of different resources to help steer through this crazy time to keep your company and your employees safe as you get back to production work. So that's all we had to present today. Thank you for joining us. We've really only scratched the surface, honestly, of the considerations that go into resuming or starting production in the COVID-19 environment. If you'd like to have a more detailed or one-on-one conversation, please don't hesitate to reach out to me. My contact information is below. Thanks again. Look forward to talking soon.